So this is going to be the third video for the assessing or addressing acute low back pain. We're going to again be back on the floor, and this time we're going to do a little bit of core activation using some isometric contractions. So as always, we're going to utilize the principles and guidelines of diaphragmatic breathing, tongue lightly touching the roof of the mouth, lips closed, and all breathing is going to be in and out through the nose. So with this position, lying on our back, diaphragmatic breathing, we want to remember that we don't want to ever hold our breath. We want it to just be nice and natural at all times. So coming on down to the floor, you can do this in bed if you have difficulty getting in and out of bed for any particular health issues. If you can do this on the floor, that is more ideal. Coming all the way down to our back, we're going to bring both of our knees towards our chests. If you need to do one at a time, that is fine, like so. Or if you need, or you can bring them both up at the same time. So what we're going to do here is we're going to activate our core musculature by trying to bring the knees up towards the chest while our hands or our arms create a counter force. So as I'm trying to bring my knees towards my head or my chest, my arms are preventing them from doing so. And you'll feel a little bit of an activation through here as you do so. And you can hold this for 2, 3, 4 seconds if you like. Breathing diaphragmatically the whole time. So again, not holding the breath. After we try and create an activation by bringing or preventing the knees from coming up towards the chest, we're then going to bring the hands underneath our kneecaps onto our shins, and we're going to try and bring the feet back down towards the floor. This time, our hands and our arms are going to prevent that from happening. And rest. And again, you can do that for 3, 4, 5 seconds, whatever you desire. Okay. Next, I'm going to try and bring the knees away from each other, away from center line, and I'm going to place the hands on the outsides of my legs, and I'm going to resist that motion. And then finally, I'm going to try and bring the knees together, and I'm going to resist that. I'm going to bring my arms and my hands on the inside of the legs, or the inside of the knees, and draw those knees in while resisting. If you want, you can even use a yoga block to do the same action. So again, just a quick review. We're going to try and bring the knees up towards the chest and head. The arms are preventing that from happening, creating a nice abdominal activation, contraction. Next, we're going to try and bring the feet and the legs back down towards the floor. Our hands come over the front of the shins. And then next, we're going to try and bring the knees away from each other. So the hands come to the outside of the knees. And then finally, the hands come to the inside of the knees as we try and bring the knees towards each other. So with all of those, it's not necessary to use 100% of your effort, you can kind of play with and explore what is comfortable for you. So if you're using 20, 30, 50% of muscular effort in all or any of those, that's totally fine. The idea is to try and gradually increase the amount of tension that you can create, and that will really help to start to tie together the deep abdominal muscles and the muscles in and around the hips to help create more stability of the pelvis and the spine. So give this a try and see how it feels. None of this should be painful. So this is, again, we're easing into trying to address some of that acute low back pain by creating some activation and stabilization of that region of the trunk. So give it a try. Hope you like it.